All right, I'm gonna take 2 exercises out of that wake up your back routine. These are for down glide restrictions in the lumbar spine or closing restrictions. So if a patient is having pain when they lean backwards and the pain is on one side, that really isn't a muscular pain. More often than not, it is a facet joint restriction to where that joint is not gliding down and back. That joint surface is not fully gliding down and back on the joint below it and not allowing that spine to extend. It feels often like we're having a pinch or just a block when we try to lean back. So what this is trying to do, we're going to take the spine in a non-weight bearing, non-gravity bearing position and go through those same motion patterns and see if we can kind of wiggle that restriction loose. So I'm going to pretend that I've got a restriction on my right side. So when I'm standing up tall, I lean backward, I feel pain on my right side. What we're going to do is the first one is closing it via side bending from below. So we're gonna go hands and knees. We're gonna draw that stomach into just a very neutral position. You can see I'm not rounding my back. I'm neutral, but I'm drawing the stomach away from the belt line. And then we're just gonna pivot. 12 to 15 repetitions. Kind of just a good normal pace, but again, we're trying to maintain that stomach being drawn in the whole time. Going off to that right side. I'm typically totally fine for patients to go the other way as well. This one typically never causes issues with that, but we're definitely trying to go with the legs going toward the right because that's invoking right side bending of the lumbar spine relatively from below. And then the next one we're gonna do is that extension moment. So if we're here, bring the hands out a little farther forward than you normally would, and then we're just gonna let the spine fall through and pull it back up. Let it fall through, pull back up. Again, I'm really not wanting you to push through any pain with that, but I expect you to have a little bit of pain and you want to kind of bump it. But it should not be getting worse as you go through the exercise. Like rep 20 should not be worse than rep 1, okay? That's important because overall, if we're wiggling that thing loose a little bit, again, that's the same motion pattern that is giving us our pain in standing. I'm okay with it being a little uncomfortable, but that pain should be staying the same or even getting a little better over time. And that is what you want to be seeing in terms of progressing this exercise with more range of motion or more repetitions or maybe a little bit more intensity as going deeper into your symptoms. So try those 2 out. Again, those are both for closing restrictions in the lumbar spine. And let us know what you think. If you have any questions, just throw a comment down below and we'll try to get to them. Thanks, guys.